You can no longer deny.
It is dangerous.
We have a shortage of OB-GYNs.
And it doesn't need to be.
We have a shortage of rural hospitals.
We can focus our efforts together on solving this problem. I think that we would really move mountains, and it's time to move the mountain.
That mountain of a problem is Alabama's maternity care crisis. There are now more counties without birthing hospitals or obstetricians than there are with them.
What do you think about midwives being part of the solution?
I mean, I think it's the best option.
Christy Harville knows the ins and outs of childbirth.
Fifth baby, yeah.
Not only because she's welcoming her fifth child,
I'm a nurse by degree.
who specialized in postpartum care.
It's 8 years.
Why are you deciding to use a midwife?
It was just something that was really heavy on my heart early on.
She wanted something different, more personal, and that's exactly what she found at Farmhouse Midwifery in Coleman.
I had several people who questioned me, like, how do you work in the field and then you don't use the field that you work in?
Alabama lifted its ban on certified professional midwives, like Laura Reeder in 2017.
I found that it is still just a lot of misconceptions.
And that lack of understanding is one of the things certified nurse midwife Sharon Holly says is limiting their impact.
I think the problem right now in Alabama is people just aren't sure what we do.
They do all the things a registered nurse can, plus women's health care and deliver babies.
We have a pretty wide scope of practice.
She leads UAB's Nurse Midwifery Pathway. The program relaunched in 2022 to help meet our state's critical health care needs and improve outcomes for moms and babies.
It is all about listening, individualizing care, shared decision making.
It is our specialty and our training to care for those who are pregnant, but also to identify when they could use a higher level of care.
A 2018 study found states that incorporated midwives into their healthcare system have some of the best maternal outcomes. And states with more restrictive midwife policies, like Alabama, have some of the worst.
One of the biggest barriers, of course, was my inability to be able to practice.
Stephanie Mitchell moved to Gainesville in 2020 with the dream of opening a birthing center.
And it's so frustrating to say, be in a place that is in need and is in want, and to have that skill and not be able to do anything with it.
Already a certified nurse midwife with a doctor of nursing practice, Mitchell had to become a certified professional midwife before legally opening the birth sanctuary Gainesville. Professional midwives can work anywhere, but their services are not covered by most insurers or Alabama Medicaid. Nurse midwives are, but they are required to work with physicians who are not in maternity care deserts. This means the women who need this care the most are the farthest away in distance or ability to pay, and the people who could help have their hands tied.
Dr. Rogers, would you be willing to loosen some of the restrictions on collaborative practice?
I do think that we could loosen up some of those practices.
Dr. Max Rogers leads the board signing off on those agreements between nurse midwives and doctors. As an OB-GYN, he has to consider the what-ifs.
The key is early intervention, and that's where certified nurse midwives are trained. So those administrative barriers we're working on knocking out.
After our conversation, he says he's getting a list from UAB's Sharon Holly of what else needs to change.
I think healthcare needs to be transformed in our state, and we're going to have to think outside the box of what we've always done in the past.
Representative Susan DuBose knows expanding the reach of midwives might take legislative action.
You know, having an OB-GYN in every county or, every 30 miles is not a practical reality anymore. And we need to come up with a plan. It's unfair to our people if we don't.
Back in Coleman, Reeder will soon deliver a third baby for Kiana Swopes.
If they were given the permissions that they need, that I think definitely they could close that gap.
One mom and baby at a time.
I feel like we could really turn the state around and make it a healthier option for families here.
Morgan Hightower, WBRC 6 News, on your side.